How do you know you have pain in a specific part of your body? You can point to an area when you see a doctor, and typically that could be the source of your pain. But there's a concept called referred pain. For instance, you could have low back pain coming from facet joints, your sacroiliac joint, or even your muscles. How do physicians figure out the source of your pain? The first thing they do is take a history where the patient tells us what's going on, how it feels. The next important part is a physical exam where the physician does testing on you. For instance, if you have a sacroiliac issue, this is a joint in your low back, there are very specific tests that a physician can do. Faber testing, Ganzelin testing, pelvic thrust testing. These are 3 specific tests used by physicians called provocative testing to identify the source of your pain. Now, different parts of your body, such as the facet joints, also have testing. It's called facet loading, internal external rotation. Those are tests for your hip joints. Physicians are armed with many different tools to help figure out the source of your pain, and physical examination is a big part of it. After the history, where we talk to patients and figure out where the pain is coming from, we do an exam. Then we have other tools such as imaging, MRI, magnetic resonance imaging, or CT scan, computerized topography, and many other tools to look through the different potential sources and figure out the exact source of your pain. Make sure we rule out referred pain or pain coming from other sources. For instance, people could have low back pain that is coming from your kidney, and that's a serious issue. People sometimes have kidney stones causing back pain. So there are exams for that we have to do, which includes costovertebral angle tenderness, which is a test that we do on the back to rule out kidney issues, and then maybe even some ultrasound imaging. For instance, if somebody has a heart attack or chest pain or myocardial infarction, they have jaw pain and pain shooting down their arms. How do you tell the difference between that and a pinched nerve in your neck? It may be easy if somebody's clutching onto their chest and having a very severe heart attack. But sometimes people don't. They have mild heart attacks where all they feel is some vague pain in their jaw and their arm, and that's the referred pain. So pain can be dangerous, especially if it's acute. Make sure you get it tested. Thank you for watching, but remember, this is not specific medical advice to individuals out there. Always consult your physician before starting, stopping, or changing a treatment plan.